Lack of quality sleep, even just for a single night, can throw off your entire day, leaving you feeling irritable and unproductive. Now, imagine dealing with poor sleep night after night. That's the reality for those suffering from sleep apnea. Despite its potential dangers, sleep apnea often goes undiagnosed. If you suspect you might have sleep apnea, you're in the right place. In this video, we'll explore some effective home remedies for sleep apnea, along with crucial insights into the condition. But before we delve into that, make sure to subscribe to our channel for more health-related content and hit the bell icon to stay updated on our latest videos. If you'd like to support us in continuing to create valuable health content, you'll find a link in the video description below. Let's jump right in. First, what is sleep apnea? Sleep apnea is a sleep disorder with significant implications for overall health. Individuals with sleep apnea encounter disruptions in their breathing patterns during sleep. Put plainly, it involves periods of halted breathing followed by resumption. This cycle recurs, resulting in pronounced snoring and disrupted sleep. Now, you might be wondering about the types of sleep apnea. Generally, there are two primary types. These distinctions are crucial for understanding and addressing sleep apnea effectively. 1. Obstructive sleep apnea, OSA. In obstructive sleep apnea, the throat muscles become too relaxed and collapse during sleep, causing an obstruction in the air passageway. Godwin Edom, a blogger, wrote about how acute obstructive sleep apnea impacted him. He said,
"I was diagnosed with acute obstructive sleep apnea. My quality of life was declining with every passing day, and I didn't know why. However, I remember being plagued with a strange forgetfulness that almost cost me my job, along with other odd events that raised all kinds of red flags. Sometimes, I felt severe heart palpitations accompanied by nausea and weakness."
2. Central sleep apnea. Central sleep apnea occurs when the brain is not able to send the proper signals to the muscles that are in charge of controlling the breathing action. If both of these conditions are present, then you may be diagnosed with complex sleep apnea syndrome. As obstructive sleep apnea is the most common, let's explore the causes of it in detail. Causes of obstructive sleep apnea. As the name suggests, obstructive sleep apnea results from an obstruction in the upper airway. This obstruction blocks the free passage of air, which leads to a disruption in breathing. The snoring sound is a result of the air you inhale and exhale hitting the walls of the narrowed passageway. Some factors that are associated with obstructive sleep apnea include obesity, a wide neck circumference, a narrow throat, a round head, hypothyroidism, acrothyroidism, acromegaly, or excess bone growth due to hormonal imbalance, allergies, deviated septum, nasal congestion, smoking, alcohol, or drug abuse. Signs and symptoms of sleep apnea. Some common symptoms of sleep apnea, besides loud snoring, include gasping for air in sleep, pauses in breathing during sleep, dry mouth on waking up, morning headache, difficulty staying asleep, daytime sleepiness, difficulty focusing when awake, irritability. The frequent interruptions in breathing may strain the heart and lead to various health risks. Learn more about it in the next section of this video. How dangerous is sleep apnea? Left untreated, sleep apnea triggers oxygen desaturation, reducing blood oxygen levels and heightening the risk of high blood pressure, heart disease, and stroke. Furthermore, it disrupts sleep, fostering daytime fatigue and cravings, potentially leading to type 2 diabetes and obesity. This fatigue elevates accident risks, particularly during tasks like driving or operating machinery. Additionally, sleep apnea may exacerbate depression and impair cognitive function. Ignoring this condition can yield severe health repercussions, underscoring the importance of seeking prompt medical evaluation and treatment. Although structural anomalies necessitate surgical intervention for a cure, certain home remedies can notably alleviate symptoms such as snoring and poor sleep quality. Most of these home remedies for sleep apnea focus on lifestyle changes. Let's see what they are. Home remedies for sleep apnea. 1. Manage your weight. One of the most powerful natural remedies for sleep apnea is weight loss. Obese or overweight people are at greater risk of having their airways obstructed due to the extra fat on their throat and neck. A study shows that a modest reduction in weight, among those with obesity, may help with symptoms of obstructive sleep apnea and reduce the need for surgery or CPAP therapy. 2. Make yoga a part of your lifestyle. Yoga is often recommended as one of the sleep apnea remedies, as it can help you improve posture and breathing. Since there is a link between low levels of oxygen in the blood and sleep apnea, you may benefit from improving your circulation and oxygen flow through yoga. 3. Sleep on your side. Sleeping in the supine position, which means sleeping on your back, can make the symptoms of sleep apnea worse. Sleep on your side instead, as that may help to keep your airway unobstructed and improve your sleep quality. If you are unable to sleep on your side, try positional therapy using special pillows or alarms to get used to it. 4. Make use of a humidifier. Though more research is required, there is some evidence that a humidifier can improve symptoms of sore or dry throat, lessen congestion, and aid in breathing. Nasal congestion and an irritated upper airway can worsen symptoms of sleep apnea, and dry air tends to aggravate these conditions. 5. Take a chance on aromatherapy. Essential oils such as peppermint or lavender can be helpful in fighting an inflamed or irritated upper airway, as they have anti-inflammatory properties. Studies conducted on both these essential oils show a reduction in sleep disturbances and the frequency or intensity of snoring. You can add a few drops of these oils to your humidifier or use them through a diffuser before bedtime. And if you don't have peppermint or lavender oil on hand, you can add eucalyptus oil to the humidifier for a similar effect. 6. Practice throat exercises. Certain throat exercises can help you to strengthen the muscles in your upper airway so that they don't readily collapse while you sleep. The 3 most common tongue strengthening exercises include: 1. Curling the tongue repeatedly for a few minutes a few times a day. 2. Loudly saying the 5 vowels I, E, I, O, and 3. Singing. 7. Avoid alcohol before bedtime. Alcohol intake worsens symptoms of sleep apnea. That is because alcohol is a relaxant that may relax the throat muscles that control breathing a little too much. Alcohol can also be responsible for causing inflammation in the airway and obstructing the airflow. Depending on the severity of the disorder, you may need to use other treatment options. We look at some of them in the next section. Sleep apnea treatment options. 1. Invasive and non-invasive applications. Continuous positive airway pressure, CPAP, and oral dental appliances like mandibular advancement devices and tongue-retaining devices are the most common treatment options for sleep apnea. There is, however, a wide variety of anti-snoring appliances to choose from, including nasal devices, position control devices, and chin straps that may be effective for you. It is best to consult your doctor to understand your particular requirements. 2. Medication. While there's no medication that directly cures sleep apnea, some medications can assist in symptom management. For example, modafinil can address daytime sleepiness often experienced by individuals with sleep apnea and their partners. Modafinil acts as a central nervous system stimulant, enhancing alertness. It's FDA, approved for treating sleep apnea-related sleepiness. Typically, modafinil complements other therapeutic approaches like CPAP therapy. Additionally, individuals with hypothyroidism-related sleep apnea may benefit from thyroid medications as part of their treatment plan. 3. Surgery. In the realm of sleep, apnea and snoring treatment, surgery is typically considered a last resort by physicians. Various surgical procedures aim to enlarge the upper airway, thereby reducing obstruction responsible for irregular breathing, snoring, and sleep disruptions. Among these procedures, tracheostomy stands out as the most common and effective surgical intervention for obstructive sleep apnea. However, determining the most suitable treatment option for an individual necessitates a thorough evaluation by a doctor post-diagnosis, ensuring a comprehensive understanding of the underlying causes. Thus, the initial step entails consulting with a healthcare professional to initiate the diagnostic process and explore appropriate treatment modalities. When to see a doctor? Sleep apnea is associated with a range of health conditions, including hypertension, cardiac issues, stroke, diabetes, generalized anxiety disorder, GAD, hypothyroidism, and arrhythmia. Left untreated, it significantly elevates the risk of cardiovascular diseases and accidents, while also exacerbating depression. If you suspect you're experiencing sleep apnea symptoms like excessive daytime sleepiness, snoring, or insomnia, it's crucial to consult with a physician or sleep specialist promptly. The primary treatment recommended for sleep apnea is continuous positive airway pressure (CPAP) therapy. However, if you're considering alternative options, it's essential to discuss them with your doctor. Sleep apnea, characterized by loud snoring and breathing pauses during sleep, can pose life-threatening risks if untreated. Lifestyle adjustments, such as weight management, reducing alcohol intake, altering sleep positions, and using essential oils, can complement treatment efforts. Additionally, incorporating relaxation techniques like meditation and breathing exercises, along with maintaining good sleep hygiene, can be beneficial. In severe cases, medication or other treatment modalities may be explored under the guidance of a medical professional. If you enjoyed this content and find it helpful, don't forget to smash that subscribe button and turn on the notification button for more interesting health content. And to support our health content creation, find our link in the description of this video.